All right, so now that you know how to draw the panoramic trough to determine your area of investigation, we probably need to look at how to trace the nerve. So there are essentially two ways to trace the nerve. I'm assuming that you are now at the curve tab, which is this tab right here, the curve tab. Okay, and the curve tab should have the arch of investigation drawn out, very much like the one that you have at the bottom. All right. There are two ways of determining the nerve, and I will demonstrate to you one way on one side and then the other way on the other side. So on one way, as I already mentioned to you, here's the sliding bar. You can take this and you can slide it back and forth, and this is how you determine, this is how you can move along that arch that you've just established, and you can look at the sectional slices in the above area. So this is the sectional slice, and this is the panoramic view, and then this is the trough that you just made, the arch or the trough that you just made. And by sliding this line, click down and sliding it left and sliding it right, you can actually move along that arch, and then you can study the slices that's above it. Okay, and that's fine. Now, if we want to find the mental nerve, you just obviously slide it to the premolar area, and there you go. That is the mental nerve, okay, or mental foramen. So what you do then is you take your mouse and you go all the way to the very top, and you click on this thing, this button that looks like 3 teeth and a nerve underneath. That's called Draw Canal. You click on that, and you're clicking Manual, and then you go to the center sectional slice, and you start drawing it. So you go here, you start clicking it, click it in the middle, click it in the bottom, and then you can take your sliding line, move it a little forward, because you know there's usually an anterior loop associated with this. There you go. Let's see if I can draw it further. There you go. That's the anterior loop. And then we can go back. Click, and you just keep moving the line posteriorly each time you're looking at the sectional slice for the inferior alveolar canal, and you just keep doing that until you can't see it anymore. And once you get to the very last one, you double click on it, click, and it is done. You'll notice that it turns red, and that essentially is your nerve. Okay, so now when you take the slider and you move it back, let's say we're treating the 4-5, you can now clearly see the delineation of the nerve with relation to the tooth. Okay, and that is how you can trace the nerve on one side. Okay, so you're actually going through each individual sectional slice, starting from the mental foramen, okay, and then you're just going from there. Now there are other buttons that basically allow you to move these individual points of the mental foramen after you've put it in, but I would say if you're going to do that, just right click and delete it, and then start all over again. That's what I would do. Right click it and hit delete and start all over again. Okay, that's what I would prefer to do, or that's what I would recommend you do. You can of course change the diameter, you can change the color of it, but for our purpose, because we're just trying to cover the basics right now, let's just leave it at that. Okay, and then if you click elsewhere, that's where the nerve appears. Okay, great. Now, another way of looking at this is, another way of isolating the nerve is to use the panoramic view. So let's slide it to the other side. And let's find the mental foramen between the 4 and the 5. Okay, so we're going to the patient's left side now. There you go. Okay, this is the other way of drawing the nerve. once you found the mental foramen, you go to this very top right section of the lower panoramic pane, and you see this thing that says TH 2 millimeters. That means this panoramic image has a thickness of 2 millimeters. You click on it, and you can actually make it as thin as you want. You can actually reduce it all the way to 0. Okay, and if you click on that, that's a very grainy but very accurate shot of a very accurate slice of your panoramic view. Now, as I had asked you before, you can use a scroller, your scrolling wheel, and you can scroll in relation to this panoramic view. So if you scroll forward, your panoramic view becomes narrow. If you scroll backward, your panoramic view starts stretching out. If you look at the very right, top right part of your screen, you'll notice what I'm doing. As you scroll it forward, it does this. It shrinks. As you scroll it out backward, it starts expanding. Okay, so this is a very good view. So I'm going to start tracing my nerve now. So I'm just going to go to the nerve button, click on it, manual, and just follow me if you will. I'm going to click on the panoramic view, then I'm going to scroll backward here, scroll some more, here, scroll, scroll, and at this point I've kind of lost it, so now I'm going to scroll backwards. Here, here, oh, I'm actually a little high, so I'm going to go here, 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 and double click right here. Okay, and now I actually have a good slice delineating where my nerve is. Okay, and if I slide it over, look at the sectional slices above, you can see that I've delineated my nerve canal quite well. We probably should make this thickness a lot thicker again, so let's bring it, just now it was 2, let's bring it to maybe 6. Okay, and then we can scroll it back. And now you have a good representation of your nerve. And that's how you can identify where your nerve is, and that's how you can, so those are 2 ways to find out where, to map out the inferior alveolar canal and all the way to the mental foramen. Now, if you find that your image is too low, for example, if you look at this one and you're going, well, this nerve down here is a little low, well, you can actually grab the nerve, you can actually grab this line, and you can actually move the image up by sliding it down. See what I just did? And so now you can see the whole mandible as opposed to just part of the mandible. So you just grab this green line and you can slide up to pull the image down, or you can grab this green line and pull it downward to move the image up. And that's how you can also find out where you can have a better view to determine where your nerve is. Okay, I hope this has helped explain to you how to find your nerve. And once you have that, that is great. I would encourage you to practice this a lot. And the next step that we're moving into is essentially how to measure the volume so that you can determine your implant size.